Hey everyone, this is Dr. Matt with the Ethos Athletes Podcast, and today is our third episode in our sleep series with Dr. Troy Anderson, who is the owner of Phoenix Neurology and Sleep Medicine, which is the largest privately owned, one of the largest privately owned clinics in Phoenix, and the largest privately owned sleep clinic in Arizona. Dr. Anderson is board certified in neurology, sleep, and bariatric medicine. Dr. Anderson, welcome to the show again.
Thanks for having me again.
So today we're going to go ahead and be discussing steps to improve your sleep, and we're going to specifically go into sleep hygiene and learn about Dr. Anderson's recommendations for improving sleep hygiene. If you've missed the last two episodes, the very first episode we talked about basics of sleep, where we went over the sleep cycle and the benefits of sleep. And then the second episode we talked about common problems that people have when that make them lose sleep, and how to fix some of those problems as well. So when it comes to sleep hygiene, there's a lot of information out there, and I'm sure some of it's good, some of it's bad. And today we're going to learn Dr. Anderson's recommendations. So what should we consider when we're thinking about sleep hygiene?
Well, it's interesting you say some of it good, some of it bad. I've actually not seen anything bad out there about sleep hygiene.
That's good.
Because I just think we have such lack of awareness. Nobody really quite understands, I haven't seen anything out there to drink a cup of coffee before you sleep, so hopefully that's common knowledge.
That's good.
But, let's talk about the equipment that I think that you use to sleep.
Okay.
And what I really want to focus on is sleep position.
Okay.
Because so first of all, you need a firm mattress because you want to stabilize the spinal cord or the spine.
Okay.
All right. And if you have a mattress that's too soft, you're going to be contorted. Your spine is going to be contorted, and you're going to wake up with back pain.
Okay.
If you have a mattress that's too hard, you're also, because your hip and your shoulder are going to be touching the bed, you're not going to be supported well inside of the abdominal area, and then you'll also have a malaligned spine, which causes back pain. So what I recommend is a firm mattress, and then you put like an A-crate on that. And what that A-crate does is it fills those gaps to support the body all throughout, and then you can keep the spine straight.
Okay.
The other thing is you can sleep supine on your back. That's great, but it's very rare if somebody can sleep on their back all night long.
No.
That's a very nice way to keep the spine aligned. But the problem with sleeping on your back is the tongue can fall in the back of the throat, and it'll increase your risk for sleep apnea. So we recommend sleeping on your side. So keeping your spine straight on your side, you want to get a pillow that's malleable to where you can adjust the head so that way it's complete alignment with the spine, so it's all straight. You want to make sure that your elbows, your hips, and your knees are all lined up, so that way they keeps your spine straight. You don't want to sleep with your arm outstretched on your shoulder, because if you do, you're going to have shoulder problems. You don't want to sleep on your wrist, because if you sleep on your wrist, you'll get carpal tunnel.
Okay.
So it's tuck in your shoulder, kind of tuck your pillows underneath your head, and then hold your wrist out so there's no weight on it.
Okay.
Like you're not having your body parts on it. So that's what I recommend, when my patients ask me what kind of mattress, what kind of pillow. And it's more about position, making sure that the line's straight up, but you're not causing shoulder issues and carpal tunnel. One of the most common causes for carpal tunnel is sleep.
I did not know that.
Same thing with children. Oh, yeah.
That's crazy.
And so their treatment for carpal tunnel is to wear a wrist brace at night when you're sleeping, because you're preventing somebody from sleeping on it and bending. A lot of people sleep with their wrist bent, which increases carpal tunnel. So it's interesting. All these like different back pain, shoulder pain, and carpal tunnel pain, all of those happen because of sleep at night.
Okay.
Yeah.
Now you mentioned pillows that you can move and contort under your head. Is there a specific pillow that you recommend?
I just like the old feather pillow that you can bend around,
Perfect.
I mean, there's a lot of people that like the Tempur-Pedic, and that's fine. The only thing I like about the Tempur-Pedic is we recommend that patients have their temperature, which we're going to get into, 68 degrees. At 68 degrees, those pillows are very temperature sensitive,
Okay.
and so they're very firm
Okay.
at 68 degrees.
Okay.
You know, and as the temperatures go up, they become more malleable. So in the stores at 2 degrees, 75 degrees, or whatever, that you can spin and twist those things. As it gets, if you're in the wintertime, even when it gets in the 50s, 60s, those beds and those pillows can be firm like rock.
Okay. Okay. So we talked about having a firm mattress, did you say a crate?
Yeah, I like a crate or like bed pillows. The only thing I don't like about the bed pillows is over time they're gonna lose their foam.
Okay.
And then you're gonna find you're gonna be in sort of a concave part where you're kind of falling in the middle.
Okay.
Where a crate kind of lasts a little bit longer.
Okay.
It doesn't cause that.
Okay. And then you also mentioned a malleable pillow. So we got the equipment down. What about the environment? What does that look like?
Yeah, so I'm gonna get into sleep hygiene now. I just can't resist it.
Yeah, please.
So we're gonna start off with the 24-hour day. So
okay, I love that.
So just like the average, I'm talking. I told you in the first part of our series, everybody's different, but I'm just gonna go through the majority of the general population. This is what a good day should look like.
Okay.
So we should get up probably around 6 or so to bright light.
Okay.
And when you get up, it's important to get your exercise in the morning. We'll take a walk with bright light and start stimulating the brain, and because that's going to be a clue to the brain to say the other key is that you're consistent, that you're doing this every day. That's going to be a clue to the brain to say, every day you need to get up at 6 o'clock. So then, therefore, he needs 8 hours of sleep. So therefore, we need to put him in bed by 10, and I need to start making him tired around 8:30, 9. Okay. So start encouraging him to get some sleep so he's well prepared. Your brain all know this. It's natural instincts. Unfortunately, sometimes our cognitive part of our brain fight that part, which is not good for us. But you wake up and you have your 1 or 2 cups of coffee throughout the morning. You go throughout the day. It's important that after 2 o'clock that you do not have coffee. It's also important that after 4 or 5 o'clock at night that you do not exercise. Okay. Because the exercise causes endorphin release and things like that are really hard to clear out by the time you go to bed. Okay. Now, this is the most important step. At 7 o'clock, it's important for us to realize that we reached the end of our day, and we need to separate the things that we cover before 7 and the things that we can talk about after 7. Okay. If you're covering a topic that makes you anxious or nervous or brings anxiety, those are things that you want to stay away from. I mentioned the last time about my daughter, about her bad grades. Yeah. That was a topic she did not want to cover after 7 o'clock. So avoid it. And same thing with my wife. If she comes in at me and it's 8 o'clock, 8:30 at night, 9 o'clock, and I'm starting to transition to sleep, and she's like, "Sweetie, our electric bill is $800. I'm like, "What? I won't be able to sleep till noon." You know what I mean? So it's important. That's that's a great alarm tool. If she's trying to get me up at 6 o'clock in the morning, and it's like, "Sweetie, our electric bill is $800. What? I'm up. That's a great alarm tool. Yeah, for sure. That's a time to talk about that stuff, but not at 7 o'clock at night. So 7 o'clock at night is a time for us to be with our family. And, we really do need to have that old adage, you can control what you can control and release what you can't control. Okay, I love that. And at 7 o'clock, you can't control stuff, just let it go. You're not going to be able to talk to the power company at that time or anybody. Yeah. So, their garbage company, whatever. It's just 7 o'clock, be with your family, have dinner, watch a movie, watch some funny shows. And then it's at 8:30, 8 o'clock, 8:30 at night, it's important for us to start turning down the lights all around the household and start helping the brain give us cues to sleep. Take a warm shower, get in your comfy pajamas. Those are all clues, and showers are a really great clue to help you relax. Okay. Watch a funny show. It doesn't have a lot of thought process. You don't want to watch, I see patients, I'm going to watch National Geographic. Are you kidding me? Some of those National Geographics, they show all these Africans, dying from malaria. Right. They're like, my goodness, you know, you want to, find, some peaceful, something or something funny or something like that. And so you take your shower, and then you have a light snack. And I would prefer a dairy snack. Okay. A dairy snack meaning a small bowl of cereal. If you have diabetes, be very careful about all that. For sure. But, if you don't have diabetes and you're not lactose intolerant, we still have these lactulose receptors that induce sleep when we're babies. They're still there. Okay. So dairy products and products that are have carbs help. I usually just take one of those little teacups and I put a little cereal in there, which like 3 or 4 bites with some milk.
Okay.
And that's a great way to just fall asleep, you
Okay.
know. And then when you go to sleep, it's important that you go, your bedroom should be only used for sleep.
Okay.
So you don't do any watching TV, you don't read, you don't eat in your room, you don't do your homework in your room, you don't get on your phone. The room is a place for you to hide away and disappear. It's your safe haven to disappear from the world where problems can enter. You do all the TV watching and everything outside, and when it's time for bed, you go inside your bed and you sleep.
Okay.
You want to make sure that your room is dark, that it's quiet, that it's cold. In fact, the optimal temperature this has been studied is 68 degrees. Cold, quiet, dark, and are the main things that we want our room to be. So put up dark curtains around. Drop the temperature to 68 degrees. You know, and then the other thing that you want to have in your bedroom is a noisemaker.
Okay.
So the purpose of a noisemaker is that it drowns out the inflections of what's going on out in the outside environment, and it also stimulates the brain. It's soothing to the brain.
Okay.
So the best noisemaker ever is actually a box fan. So it's just a cheap $20 box fan that you get at Target. You blast it on high. You point the air towards the wall. Makes this huge noise. Puts you right out. The phones are good, but the problem with the phones and all that is that if you get alerts and things, that could wake you up.
Right.
And then the lights can come on.
Right.
And that sort of thing. So that's not good. And then the other things I don't like is these like jungle sounds, you know, because you hear like rah, rah, birds and things. That wakes you up, you know. You want something that's very consistent. Now, some patients will say, well, doc, I watch TV. Yeah, I have that white fuzz noise, you know, and yes, if you grew up with that and you sleep well with that, that's fine, you know, if it's not a problem. But that light could stimulate your brain to wake up.
Right.
And so you may not want the light on. But that fuzz, that, you know, that white noise sound could be good for you.
For sure.
Yeah. So, and then you want to go to bed around 9:30, be in bed around 10.
Okay.
And then sleep until 6 o'clock in the morning.
Okay.
Now, a lot of patients will ask, well, you know, doc, what do I do if I wake up in the middle of the night? And so you kind of go through, one of the worst things you can do in the middle of the night is toss and turn all night long.
Right.
After 10 or 15 minutes, just get out of the bedroom and go back, maybe have a light snack. Maybe you can you watch maybe a small little segment to figure that awake, you know, but usually just having a small light snack. Sometimes we worry about things in the middle of the night, but when you're in that transitional sleep period, it's so like emotional. It keeps you up. And then when you get up, and you actually have a light snack again, you realize, that's not I don't understand why I'm worried about that. We've got it handled. We sent the check out yesterday or whatever.
Yeah.
You know, it's going. And you realize it's not that big of a deal. And then you can go back to sleep. So those are some of the things that when you wake up in the middle of the night, but being very consistent, that you go to bed at 10 and wake up at 6 in the morning.
Okay.
Another clue, like a lot of you mentioned earlier in the segment before, that patients have their minds will race and that sort of thing.
Yeah.
Well, one of the things that you can do, and this is a little bit of a trick, is we have several parts of the brain and their function. One part of our brain is our executive center, our thinking center, and that part is the brain that keeps thinking. But we can trick it into being more dormant when we remember, because that's a different part of the brain. The memories are temporal and parietal. And so what I like to play tennis live. This is an example. And so sometimes I'll hit like a great shot, you know, and then it feels really good. You won it, you hit the shot, you thought you won it, you hit it, and you remember in your head, it's, you know, you have about 3 or 4 of them. And so when I'm sleeping at night and my mind, when I'm trying to sleep at night and my mind's racing, I'll think about that movie, that visual movie in my head where I can actually see the ball coming, I'm hitting it, you know, and it runs in my head over and over and over again. Recalling memory or something like my kids singing, or it's like a happy memory like that throughout the day will calm the executive center down, and then patients will sleep. It's very effective. A lot of my patients really sleep very well by doing these different ways, mental tricks to slow down the executive center. So that's basically your 24-hour cycle on sleep hygiene. And I know it's a lot of information. It is on my website too, at phxneurology.com. So you'll see it there. But because I call it my sleep pearls. And so it's just, you know, something that I think everybody should do. And like I said, this is a great dinner conversation because they're always asking me how do I sleep, and then the people just don't realize how much this world is influencing, how much their computers, their phones. I see it a lot in kids nowadays is they have notifications all on and they shut it all off because all night long, they're getting texts. I got my daughter's phone. I'm picking on her, but, and we had it from her because she was on it. So you can't be on it, it's late. So I had it. And one of her friends sent her a text at 11:54, at night. I'm like, I can't believe it. You guys have got to understand that after 9 o'clock, you guys all need to be in bed. There's no reason for you to be texting each other at 11:54 at night. So we just in today's society where the world can penetrate us, technology can penetrate every minute of our life.
Right.
We need to be disciplined and think that sleep is important, just like food is. And I'm going to prepare for it, and I'm going to make sure that nothing's going to disturb me during that period of time. Okay.
Now, one of the questions I have, so when you wake up, alarm clock or something like that.
Yeah, right. I saw that, I know you asked this before.
Yeah.
So obviously light is much better to wake up to than alarm clock. So alarm clock stimulates you, and then you kind of get adrenaline rush, your heart beats fast and things like that. There hasn't been any studies to show that there is implications to our health waking up that way. Uh-huh. But from a physiologic standpoint, that's not the way the body is preparing to wake up. It's waking up slowly by increasing glucose levels and hormone levels. It doesn't jolt you out. Right. And so, probably, and then not only that, is sometimes your alarm clocks, is not like when you finish that 90-minute cycle, right? Right. So by going to bed consistently at 10 o'clock, your body will know what's a good time for you to wake up, and to the point where you may not even need an alarm clock. You just kind of get up. As we get older, we get more sensitive to light as well. So we have to keep that in mind. So light wakes us up easily. Mm-hmm. I can't sleep in anymore. I'm 50 years old now, and so I try to sleep in. I can't. Once the sun gets up, I get up. Right. And just the way it is nowadays. Even if I go to bed at 2 o'clock in the morning, versus 9 o'clock at night, doesn't matter. I'm still getting up and the sun comes up. Okay. So we have to keep in mind about those environmental influences on us as well.
Okay. So if someone, you had mentioned earlier, having dark curtains over their window, how do they kind of obviously they
I know.
bypass that part?
Well, the natural person, these are patients that have insomnia problems, right? So for the normal person, they can keep their just their blinds closed, and then that light will penetrate through that, and that'll wake you up. Okay. So light's much better. Also, a lot of these, I do like the wearables because the wearables have the vibration. Yeah. The vibration's a lot better to wake up to than just blasting in your ear type thing. Some of these units nowadays, actually the light comes up with the alarm clock, so it actually lightens up the room. You could set even your, I have had my patients set their lamps to one of these.
Like the smart.
Yeah.
Plug, I forget what it's called.
Yeah,
the plug-in where you can go and just say.
Yeah, you do it at Christmas time. You plug in those things that turn on at a certain time. Yeah. So I'll often have some of my patients use that to turn on to wake themselves up instead of the alarm clock. Okay. Yeah, cool, especially ones with anxiety because they don't I'm trying to reduce their adrenaline load, not increase it.
Yeah, for sure. Okay, yeah. I love that a lot. So wearable like a Fitbit or something like that, so that you're okay with that being in the bedroom, because I know we mentioned really no electronics in the bedroom. You want to avoid that.
Mm-hmm. But those Fitbits are really good about controlling your sleep. Yeah. And then they have the vibration around the alarm clock, so I do like that.
Cool, perfect. Mm-hmm. And then one thing that I know I have some patients do, or that they come and tell me that they do, is once it gets to a certain point at night, and we'll say 8:30, whatever it is, if they are watching TV, they'll put on like the blue light filtering glasses, or I don't know if you can speak to that, how much that works.
Well, that's interesting because we wake up to blue light, so that's a light that actually, if you think about it, when you wake up in the morning, it's kind of this gray blue. Right. It's really not like white light, But, there are different things. Definitely, we are sensitive to different light wavelengths, but it just varies all across, I think for the most part, the brain's pretty smart. I haven't seen any studies to show that it's necessarily better, but we respond definitely different to different wavelengths.
Okay.
Yeah.
Okay. Cool. Is there any other tips that you have as far as your sleep hygiene and improving?
No, I mean, the biggest tip that I have is just that we just need to be aware of how important sleep is, and not take it for granted. And once we see how important that is to our health and our well-being and our cognitive function, I think we could do a much better job preparing for it and protecting it. And we've improved in society so much, and we're so intellectual and we're smart these days. But sometimes we can also be pretty stupid as well.
Yeah,
so,
for sure.
So we need to be smart and judicial and wise,
right,
and protect something that's beneficial for us. And, it's really a pleasure. I mean, it's a pleasure to be able to sleep and wake up restored. That it really is a gift, and let's not take it for granted.
Yeah. No, I love that.
Yeah.
Awesome. Well, today we discussed sleep hygiene and steps to improving your sleep. So I'm just going to go and mention 3 things that Dr. Anderson talked about, which is making sure that you have a firm mattress to help stabilize your spine at night. You can use a crate on that mattress as well, and then also get a pillow that you can manipulate at night. That way it allows you to be comfortable. Sleeping on your side is best, and then I'm not going to go through his 24-hour day out to perfect sleep. You can go and listen to all that again. And so, yeah, hopefully that helped give you a lot of tips on getting the perfect night's sleep. In our next episode, we'll be talking about sleep and athletic performance. And in the meantime, Dr. Anderson, thanks for being on the show.
Thank you so much.
And hope you enjoyed the show, and we'll catch you on the next episode.
Thank you.